Well wishes are pouring in for former U.S. President Jimmy Carter, who is getting treatment for cancer. Mr. Carter says the unnamed cancer has spread to other parts of his body. President Carter, who is 90, announced Wednesday the cancer was discovered earlier this month during surgery to remove a mass on his liver. President Barack Obama spoke to Mr. Carter late Wednesday and wished him a full and speedy recovery. Mr. Carter expects to release a more complete public statement about his cancer once more facts are known. Since leaving the Oval Office in 1981, the former president has been hailed as a global humanitarian. Now, scientists have developed a simple urine test that could detect pancreatic cancer much earlier than at present. The researchers looked at almost 500 urine samples and found a protein signature only present in people with the disease. The signature was found to be 90% accurate. The scientists from the UK and Spain who developed the test hope that if its early promise is realized, then it could be possible to diagnose patients much earlier and offer them treatment. Pancreatic cancer is often very advanced by the time it is diagnosed with a high mortality rate. The United Nations say a measles outbreak in the copper mining Katanga province in the Democratic Republic of Congo has killed more than 300 people and infected at least 20,000. The UN Office for the Coordination of Humanitarian Affairs says hundreds more deaths have likely not been documented due to difficulties accessing remote areas. A draft report by UN office says the measles epidemic in the province of Katanga is only worsening and gaining ground. Now, striking doctors in Ghana's public health facilities are threatening to quit if negotiations with the government fail to yield results. Some 2,000 doctors in Ghana's public health facilities withdrew emergency services and are only attending to inpatients. The action is mostly affected the poor and underprivileged who depend solely on public health care. The strike began on August 7th as part of demands for improved allowances and other non-salary benefits. Dr. Justice Dufu Youngson is Deputy General Secretary of the Ghana Medical Association.
This looks a little absurd because the very labor laws we work with in this country mandate that employees, especially professionals like us, should have these arrangements in place. We have done our utmost best to ensure that this is done. It hasn't happened. And we've gotten to a point where we are saying enough is enough.
On the face of the law, it is illegal. I mean, when you are negotiating or talking to somebody and you embark on a strike with a view to pressurizing the person to meet your demands, it's just like putting a gun at the person's head and telling him to accede to your demands. It is never done in any negotiations.
Ghana's President John Dramani Mahama also reacted to the strike.
Any agreements that are reached in respect of allowances or conditions of services would have to be appropriately captured in the budget. And I want to say for emphasis that I will not authorize any expenditure on wages and compensation not provided for in the budget. Fiscal discipline requires that not a single pesewa is spent on remuneration outside what has been budgeted for.
The Ghana Medical Association says the doctors are likely to either call off the strike or resign en masse on Friday.